Good Morning Doctor, brought to you by Parkway East Hospital. We go out of our way to make you feel at home.
Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore. Welcome to Good Morning Doctor. And this morning we welcome to the studio Dr. Shirley Bang, a urologist from Parkway East Hospital. Good morning.
Good morning.
And of course, Stephanie Carrington is here as well. Is your microphone on, Doctor? There you go.
Is it
Yes,
on?
it is.
Okay.
So today we're going to be talking about UTIs and urinary incontinence.
That's right. Yeah, because I was looking into it because it's actually like quite common amongst women. We grow since as being a little girl, it's always a common thing. And I actually read up that it's 1 in 5 women get UTI.
Yes. But
Yeah.
what is UTI?
UTI stands for urinary tract infection. So it's an infection of the urinary tract, whether it's the lower urinary tract, which is the urethra, the most common, the bladder, actually can go all the way up to your kidneys. It's also considered part of the UTI.
Wow.
Yeah.
So if you don't treat it from the bottom, it's
That's
just going
right.
to keep climbing up.
That's
wow.
right. That's right.
Okay, so is it? I'm actually quite interested. Is it mainly women that get it? Do
Yes.
men get it too?
Men get it too, but usually women.
Okay.
Yes, because of our vulnerable anatomy that we're born with.
Okay.
Yes.
Okay. Is it because our system is a bit shorter?
Because our urethra is much shorter than the male, as you expected. It's only 4 centimeter. So bacteria goes up easily, and then they multiply. Then that's how we get the UTI.
Okay.
Yeah.
Okay.
So what are some of the symptoms if someone gets UTI?
UTI. The most common would be painful urination, usually towards the end of the stream. And then, most women will tell you that after they pee and then towards the end they feel this very weird feeling, and it's unbearable feeling. Burning sensation, and then they keep going, frequency, and then incontinence. So they feel the urge and then they just can't hold it, and then sometimes it will just leak out involuntarily.
Okay.
And then there's a smell. Sometimes the urine looks cloudy, sediments, things like that. And pain.
That's if left untreated.
Usually the presenting symptoms would be like
it'll
that.
It'll start.
Yes.
But the thing is, I think there's a bit of a stigma around it. It's not like, it's because you lack hygiene or anything like that, right?
Yeah, that's right.
Your body is just—it's a sign. I feel to
and
say.
blood too,
Yeah.
and blood in the urine too.
Blood in the urine.
Wow.
Yes, that's right.
Wow.
Well, that'll be scary, man.
Yeah, that's
Imagine
right.
going for a pee and all of a
And
sudden peeing
correct.
blood.
Men could get it too, like she said. So watch
Yes.
out.
Now I'm scared. Okay, so what can people do to prevent, for
Yes.
men, let's say, because it's rare, but
Okay.
men do get UTI as well.
Yes. I think for men and women, some of the prevention methods would be quite similar. Most important, please drink enough water. 1.5 liters a day if you can.
Okay.
Not Coke, not coffee, not tea, just water. And then do not hold your bladder. Some occupations are at risk, such as you guys. Because if you feel like your bladder is full and then you're busy, or some patients, they're afraid of public toilet, so they will hold their bladder.
Yeah.
And then if you do this a few times, then that's how you'll get UTI.
Okay.
So drink enough. Do not hold your bladder. And then there are some hygiene practices that you have to do, such as after intercourse. You have to drink more, you have to pee. And then we'll talk about the supplement and the medication part.
Okay.
So probiotics, cranberry.
Yeah, probiotics.
Very important.
That's a big that's a key, because like when we get sick, we take antibiotics, and so once you start taking antibiotics, you're killing off the probiotics.
That's right.
And then
That's right.
These are the things that can happen. You can get UTI.
So cranberry juice, it's not a myth.
Cranberry juice it's not good enough. We have to take the cranberry supplement.
Oh,
the
I
tablets.
see. When you mentioned cranberry, I thought you were talking about cranberry juice.
No, not the juice, not the fruit.
Cranberry
The
supplement.
the
I thought it
tablet.
was the
see.
No, because you can't. there's no way that you can drink enough juices to get the amount of active ingredients inside to prevent UTI.
Okay, let's continue to talk to Dr. Bang on The Big Show TV. We're talking UTIs and urinary incontinence. It's the same thing, actually.
No. Not quite the same.
Okay, we'll talk a little bit about that on The Big Show TV. And Dr. Bang has also got a few models to show us as
yes,
well.
yes.
Meantime, here's Cheat Codes and Julia Church, Modern Tragedy on KISS 92. Okay.
Yeah.
All right, let's... are we going to have a look at the...
You want to... I mean, these are just the anatomy part.
Maybe we should use that to just explain to everyone how
Okay,
the area gets infected.
Okay. So you can see this is a female pelvic anatomy. So this is the urinary bladder. This is our urethra, vagina, and anus, rectum. So you can see that the urethra is very short and it's actually very near to the vagina and the rectum. So contamination happens. After intercourse, contamination happens, and there's always this good bacteria over here that can be depleted. Like what you said, sometimes you take antibiotics for something else, then you just kills away the good bacteria, and then your pH becomes unstable.
Yeah.
Then that's how you get yeast too.
Yeah. See, this is the thing. So, okay, that time of the month for us ladies, we gotta,
Yes, correct.
tampons. Does that impact it as well?
Some women, yes, tampons or menstrual cup increase
Okay.
the risk.
Yeah, that's growing in popularity now. The
Yes.
I
menstrual
mean, that's
cups.
why.
Yes,
That's
that's
why. I mean, many women still use like pads, right? So there's less risk if women use pads.
I think it depends on the individual. Some women I know they use menstrual cup, tampon, no problem, But some they switch to menstrual cup, then they get recurrent infection. So I think for the women, it's very important that you know what triggers off your UTI and anything that any changes that you make to yourself, like new pad, new liner.
Yeah.
Then you just stop.
Yeah.
Yeah.
Now some of the symptoms and the
Yes.
signs of
Yes.
UTI,
Yes.
it kind of also mirrors yeast infection, doesn't it?
That's right.
Yeah.
The itchiness is quite common. UTI, they get this itchiness around let me see, this area here. Sometimes they get itchiness around the urethra. Vagina yeast also, you get itchiness around the vaginal canal. But I think for yeast, they usually get this whitish tofu-like discharge. Yeah. So that's the difference. But they are related. So if the women gets vagina yeast, then higher chance of getting UTI. And if they get UTI, they take antibiotics, then they get yeast.
Okay. Okay. Now
Right.
now is UTI is it more common in younger
No, actually common.
individuals? Okay.
Yes, all ages, but just different risk factors, different causes.
All right.
Yeah. So for younger ladies, usually it's because of the habit of not drinking enough, holding or intercourse. Stress also can cause if you don't rest enough. And then the older ladies will be perimenopausal or menopausal changes.
Man, all these things we ladies have to go
Yeah,
through.
that's
it's
right.
just like you solve one thing and then it's like something else and then another thing. It's just
Yes.
non-stop.
That's why there's International Women's Day
Yes.
and International Women's Month.
Right?
Yeah,
I
'cause
think
you ladies are
finally.
Yes.
extraordinarily strong.
Yes.
Right?
Yeah, it's a higher risk for us to get all this, but we still able to manage this. Yes,
Yeah.
and on top of all the changes that we have to go through.
Right. It's pretty amazing. Amazing, you women. Now, okay.
Yes.
My question just now was UTIs and urinary incontinence. Is
Yeah,
it the same?
yeah.
And we were going to explain that.
Okay, so if you have UTI and then, when your bladder is irritable, so they get this urge and then sometimes you will get this incontinence. Whereas if it's just pure incontinence without UTI, then there are two types, the stress incontinence or urge incontinence. Stress is usually in ladies after they deliver, so their pelvic floor is weak, so when they cough and sneeze, run or jog, then there's leakage. Urge will be overreactive bladder, when the bladder is very sensitive. So they feel it, they have to go. If not,
Okay.
then there's this leakage. Yeah,
Okay.
but we have to prove that these ladies do not have UTI before we call it a a normal urinary incontinence.
Okay.
Because the treatment is very different.
Yeah.
Okay.
Yeah.
So for people who don't have UTI and have urinary incontinence, what's the treatment like?
Okay, so first, usually we talk to the patient and then we kind of know whether it's mainly stress or mainly urge. Yeah, because if it's stress incontinence, then pelvic floor exercises, Kegel exercises.
You know, I was gonna say, like, does that help?
Yes, of course.
Wow. So the
Yes.
stronger your floor is,
Yes.
you can prevent.
Yes.
Wow.
Yeah.
Do you know what Kegels are?
I know men
Yeah.
can't do Kegel
Men
exercise.
Can.
Of course.
He's like, whoa.
Just for the ladies.
Wow.
Can. But
Every muscle in our body can can work it out,
Yes.
man.
But I
I'm doing
think-
it right now.
Yes. But it's good to see a physiotherapist and do it correctly.
The
Rather
Kegels?
rather than watching YouTube and all that.
Okay.
Because we have, like you say, we have so many muscles in the pelvic floor.
Yeah.
We sometimes don't know the correct technique, and then you might be contracting the wrong muscles.
Okay. I thought maybe like a gynecologist, but
No, physio, pelvic floor
Physio.
physiotherapists.
Alright.
They are the best.
Or maybe I've been
Yes.
doing it wrong.
Yeah, that's right. Yeah.
So what other benefits
Of-
I mean, basically, I mean, if we do Kegel exercises and all
Yes,
that,
the
what?
main benefit would be to strengthen the pelvic floor, and then actually the main purpose is to prevent the stress incontinence. But sometimes it's done to train the bladder as well, because some patients, if they have a little bit of urine inside the bladder, they just want to go to toilet, either maybe habitual or convenience. So then the physios will teach them some pelvic floor to reduce the sensation and to help them hold longer.
Okay.
Right.
Yeah.
So then holding
Yeah.
and training,
Yes.
they're two very different things then? Because we don't want to hold too long
Correct.
with the risk of UTI.
UTIs.
Yeah.
But
So-
we, at the same time, we want to strengthen.
That's right.
Okay.
So I think you must know your body. Holding when you have a full bladder, just because you are busy or you're holding, then that will lead to UTI. But if you know you have overreactive bladder, that your bladder is not full, you want to hold a bit longer to train it, then that's okay.
Okay.
Yeah.
Okay. So the number one obvious sign or symptom that's like, okay, I think I've got it.
Yes.
What is that one?
For UTI,
Yeah.
I think the number one would be, is something changed? Your habit.
Okay.
I think that's very subtle. That means if usually you go, your frequency, it's a bit more frequent. How come there's some discomfort? How come there's a little bit of burning and it just doesn't feel right?
Yeah.
Or some pain, some low back pain? Then just go to the GP and get checked. Yeah.
Right. Persistent lower back pain.
That's right.
Right?
That's
Because everyone gets back pain
Yeah,
these days.
exactly.
Yeah.
Exactly.
Yeah, I was
So-
in the gym
Yeah, yeah.
yesterday. This morning I woke up, I'm like, oh, maybe
Age,
not
man.
lower. I think so.
Right? No, honestly though, it is. But I was gonna say though, so say you have the back pain.
Yes.
Is it but without the burning? Or do you have the burning? Is the burning the like
No.
Okay,
no,
hold
no,
on,
you don't
Dr.
have-
Bang.
Yes.
You will. Why don't you ask her that question again when we
Okay.
go back on air?
Cool.
Okay, cool.
Kiss 92 traffic.
A couple of, incidents. Broken down vehicle on the SLE towards the BKE after Woodlands Avenue 2 exit, and there's been an accident on the SLE towards the BKE after Woodlands Avenue 2 exit. Please avoid lane 2 there. Heavy traffic on the CTE. This is in the tunnel towards the AYE at Orchard Road exit, as well as the PIE towards Tuas between Clementi Road exit and Toh Guan Road exit. Drive safe. We're back on The Big Show and The Big Show TV, and our guest for this morning is Dr. Shirley Bang, who is a urologist, and we've been talking about UTIs and urinary incontinence.
That's right.
Yes.
Yeah. No, I wanted to ask
yes,
because I think we
yes.
left it off with back pain is a sign and symptom of UTI.
yes,
Now,
yes.
say I've got the back pain,
Yes.
but I don't have the burning. Does that still could that potentially still be UTI?
if just back pain
Yeah.
and then no other symptoms, maybe observe a little bit longer.
Okay, so Glenn, you were
Yeah.
saying that you went to the gym, you've got that back pain, so you need to observe, all right?
Knock on wood.
Yeah.
I'm okay. I'm quite sure I'm okay.
Yeah, I think the back pain, we will know, our usual musculoskeletal back pain and something a bit
Yeah,
different.
different.
Usually we know. Yeah.
Okay. Now you were saying like there's treatments and
Yes.
remedies, and we were talking about cranberries because I was thinking cranberry juice. You just like load up on the cranberry juice to flush it out. So
Yes.
that's not enough. That's not we
Correct,
need-
not enough.
Okay.
But this is just this is for prevention.
Yeah.
Yeah. So you need to take the supplement itself, the tablets.
Oh, so even if so we should be doing it now.
Well, if you don't get UTI, you don't really need to take it regularly. But if you get recurrent UTI,
Okay.
then you should take it.
Okay,
Yeah,
okay. Like
yeah.
how about the dried cranberries? I
No.
love dried. No,
I know.
I love dried cranberries, like coated because
I know.
without sugar. They have
Right.
it where they sweeten it
Yes.
with apple juice.
Yes,
so
yes.
good.
Yes.
Nice little snack. That's not
Correct.
enough,
Yes, it's, as a snack, it's good.
but
Yeah, I
not
don't-
for UTI.
Yeah, I don't
Okay.
think it's good enough.
All right.
Yeah.
And as you
the-
mentioned, doctor, I mean, juice. How much
Yes.
juice can one drink,
no, correct.
right?
You can't. You, I mean, you can't drink like 100 glasses of juice every day. It's
Well,
impossible, you know?
Yeah.
And it's sweet.
You get
Yeah.
diabetes.
Yeah.
That's right. And then you get your UTI.
Yeah. Now coffee. Okay. Coffee.
Okay.
Yeah.
A coffee by itself doesn't cause UTI.
Okay.
Some patients are a bit sensitive to some beverages, but I think it's an individual thing. But overall, coffee is okay. But if you just drink coffee every day without proper hydration, then maybe the hydration part
Yeah.
cause the UTI.
Yeah,
Yeah.
I don't think anyone can drink too much coffee. I
Yeah.
I-
Could be bouncing off the
No,
walls,
Yeah.
we have.
Really?
We have ladies who drink 5 to 6 cups
Yeah.
a day, and then they come in with urge incontinence and keep going to the toilet
Oh, dear.
without realizing that they're overtaking their caffeine. Yeah.
I'm an extreme sort of guy. When I like something, I take a
I'm
lot
the
of
same.
it.
I'm the same.
But at the same time, I'm not going to have like 7 cups of coffee a
Yeah.
day.
Yeah.
So,
Yeah.
like I was telling Stephanie
Yeah.
this morning,
Yeah.
right? As far as coffee is concerned, I have maybe two cups of coffee during the
Yes.
show.
Yeah.
And that's it. I don't have
Yes.
coffee.
Yes.
Honestly, when you
anytime.
told me that, I was actually pretty surprised because you
Yeah.
do the morning show every day of the week, so I thought you'd be
Yeah.
just loading up on the coffee. But 2, that's not bad.
Yeah.
Not
Two
bad,
is
right?
okay.
Yeah.
Especially
Two is
on a
okay.
Wednesday, because
Yeah.
Tuesdays I go out and drink with my friends. So yesterday night I had 7 martinis, which I think was a little bit too much. So I woke up this morning, I'm like, I need to hydrate.
Yes,
as
good.
we-
Good thinking.
So I had like
Yes.
probably 7 cups of water, and I've been
Okay.
like going to the toilet like a
Yeah.
few times, but
Yes.
I'm good now.
Very good.
Then took my
Yes.
essence of chicken with
Wow.
cordyceps and everything. I
Okay.
am pumped and charged to go right now.
Yes. Very good.
For more martinis.
No more.
No,
That's too much. 7 is too much. I think max for me 5. Okay, it's 8:23.
You by Putian, home of the freshest oyster.
All right,
Yes.
we're back. Okay, so we spoke about UTIs and the complications it can lead to. And earlier you mentioned it could lead to like kidney issues.
Infections,
Yeah, an infection.
yes.
What
Yes, yes,
other
yes.
what other complications can UTIs cause?
I guess the number one complication would be, we call it pyelonephritis, which is infection in the kidney.
Oh.
I give you one scenario which is quite common for a lady who has not had UTI ever in her lifetime because she doesn't recognize the symptoms. So she just feel, maybe a little bit uncomfortable. I'll just drink more water to flush it out. I go a bit more frequent. Okay, maybe I drink more coffee that day. And then if you drag it on for like few days, then all of a sudden, bam, you get this high fever, chills. Yeah.
Okay.
Yes, and back pain.
Yeah,
So
yeah.
usually that's when it already got into the
Well, 'cause-
kidney.
okay, so since we're talking about
Yes.
kidneys and we're talking about coffee, because when you
Yes.
drink too much coffee, you also increase your chance of kidney stones. Now, is kidney stones linked with UTI? And
Not so common as the general UTI, but if you keep getting UTI, recurrent UTI, sometimes you can form stones. It's like chicken and egg. So some patients, if they have stone, then the stone act as the nidus for bacteria, then they keep having UTI.
And men get kidney stones more. It's more common.
More common.
Yeah.
Oh, is it?
Yes.
Yeah.
Yes.
Okay, I've got a question here from Jacqueline. Jacqueline says, "Hi, good morning. Not sure if this can be answered by the doctor." Of course, the doctor can answer anything.
I guess.
Oh, so she says, if we drink a lot of water and keep going to the toilet, is this bad for the kidneys? So,
Okay.
maybe overdoing it.
Yes. So, water intoxication. So I think if you drink 4, 5, 6 liters a day, no, it's not good.
Yeah.
So you are overworking the kidneys, and then you get dilution of your body salts and all that.
Right. And that could be bad for the kidneys, right?
Yes,
if you're
yes.
overworking it.
Yes, that's right. Yeah, so no need to overdo it.
Yeah.
No? Yeah, 1.5, 2 liters, and if you're exercising, 2.5 enough.
Yeah.
Yeah.
See, I'm like you, Glenn. When I'm like 0 to hero. When I do something, I do it all the way. I'm committed, right? So this is one thing that I learned. I didn't even know that there was such a thing called overhydration.
That's
but
right,
like
that's right.
it's a thing.
I've heard of water intoxication before.
Correct.
Because sometimes you just feel like, oh, okay. I mean, I've got to drink a lot of water, right?
Yeah.
I'm gonna do one better instead of 1.5 liters a day. I'm gonna do like 2 liters a day.
Competitive.
Sometimes even a little bit more like that,
Yes.
can overwork your kidneys by quite a bit.
Because I think nowadays we have this trend of the really big water bottle.
Yeah.
Yeah.
Like that holds 2 to 3 liters.
3 liters.
So then you can just drink without noticing it. And then they will come in and say, I pee a bit more frequent. At night I wake up so many times.
Yeah.
And then you ask them to fill up a diary, and then they are drinking like 4 liters. Yeah.
Too much of a good thing is not good.
Yeah. Or how about like if you have too much like acidic food, like lemon juice, lemon water. Yeah.
Too much acidic sometimes can trigger UTI because they irritates the bladder.
Because I was doing this thing where like every morning you have lemon water and
Apple
then
cider vinegar.
Yeah.
Wow.
Yeah. I mean, I didn't get UTI, but
Yes.
I read up on all the risks.
Yes.
Yeah.
Sometimes too spicy, too sour, something too extreme. Then triggers off their UTI, or too much alcohol for some women.
Right.
Not all.
So balance.
Yes.
Yeah,
balance.
everything needs to be
Just
balanced.
needs
And
to
I think we all have to know ourselves and our
Yeah.
bodies
Yeah.
because we're all different.
That's right. That's right.
Yeah?
Yeah.
Okay. Now, can UTIs be treated through natural remedies? Because we spoke about the supplement just now, the cranberry supplement, and then Steph mentioned about her cranberry snacks and stuff like that, which you said is a good snack.
Yes.
It won't do her any harm. It's
Correct,
much better
correct.
that than potato chips.
Yeah.
But are there
That's
other natural ways to prevent UTI?
I think if natural way to prevent would be like, water intake, and you can take your cranberry. But cranberry supplement or probiotic supplement is quite natural. Yeah, it's a natural thing. You just replenish your own good bacteria. If you're talking about natural remedies to treat, then that is a bit sensitive, because by right, antibiotics is what we need to kill the bacteria and to prevent it from keep coming back. So I know that some ladies like to drink a lot of water to flush away the bacteria, and then their symptoms actually get better.
Okay.
Sometimes you get away with it, sometimes you don't. So if your symptoms persist and you're not feeling better, then you need antibiotics.
Right.
Yeah. But then if you have the antibiotics, you're killing off the probiotics. So then we gotta kind of crank up the probiotics.
Correct. So if you're taking antibiotics for any reason, you wait for about 2 hours, then you take your probiotics.
Right.
Yeah. So to prevent yeast, to prevent your diarrhea, your loose stool, all these things.
Yeah.
Okay.
But it's okay, I guess. It's okay for ladies to not, once again, don't drink too much water,
Yes.
but to try and flush it out, see if they feel better. If they don't feel better, then they go and see a doctor. It's like, it's okay for them to do that, right?
I think you can do that for a short period of time, but usually the advice is still you have to see someone for
Yeah, that's
antibiotics.
right. And the next question is, how long do they do it
correct,
for?
Correct. Some of them do
Yeah.
it for days, and then
Right.
the next thing is they get this kidney infection.
Oh.
Okay, let's go on air one last time, okay?
Okay.
Kiss 92 traffic.
All right, checking on the traffic situation right now. Vehicle is broken down on the CTE towards the AYE after Ang Mo Kio Avenue 1 exit. Another broken down vehicle on the PIE towards Tuas after Pioneer Road North. And yet another broken down vehicle on the KPE towards the ECP before Airport Road entrance. Look out for those vehicles and drive safe. We are back on The Big Show and The Big Show TV. And our guest for this morning is from Parkway East Hospital. She is Dr. Shirley Bang, urologist. And we've been talking about UTIs and urinary incontinence.
That's right.
Yes.
Now, we were just discussing oral vaccine.
Yes. So there's this separate condition which we call recurrent UTI. Is when the ladies they get 2 UTIs in 6 months or 3 or more UTIs in a year.
Oh,
wow.
Yeah, so they keep getting this UTI. Of course, you can do the usual prevention, probiotics, cranberry. Sometimes they need more. So conventionally, we use prevention antibiotics. And then, of course, nowadays we have oral vaccine.
Oral vaccine?
Yeah.
So this is not
Yes.
antibiotic.
No, they're not antibiotics because
Wow.
in the past, some are not very open to taking antibiotics regularly to prevent. Because even though it's a low dose, but still it's antibiotics.
Okay.
So then they come up with oral vaccine.
Okay.
2 kinds, oral or tongue spray.
Wow.
Yeah, so against different bacteria, mainly E. coli,
Yeah.
the most common bacteria for UTI.
Okay.
Yes.
So
So-
then we can skip the antibiotics and just go straight to the vaccine.
You can. This is it's an option for these ladies. Because,
Okay.
actually they are quite disturbed with this recurrent. They miss time
course.
of work, they feel lousy and all
Yeah.
that. So this is definitely an option.
So this
for
oral
them.
vaccine is to prevent
That's
UTI.
right. That's right.
So for people who
Just get it
we
very
just-
often.
Yes.
Yeah, they're just prone to getting
Correct.
UTI.
is it like
right.
like once a year?
So the initial period will take it for 3 months.
Okay.
Yeah. Then subsequently we have the oral ones. We have like booster dosages and then things
So it's like
that.
the COVID vaccine.
That's
in a
right.
way.
So it
Wow.
stimulates our gut mucosa to produce antibodies and white cells even before the infection. Yeah.
Okay. So if they want to find out more, they can look for you.
Yeah. That's
There
right.
you go. Look for Dr. Shirley Bang at Parkway East Hospital. All right. If if you've got any questions about UTIs and urinary incontinence you're experiencing for yourself, go look for Dr. Bang.
Thank you. Thank you.
Before we let you go, Doctor, anything else you would like to say to Singaporeans, who are listening right now?
I think recognize the symptoms early and seek for help. Yeah, and don't feel shy to talk about it. It's actually very common.
Yeah, it's not an icky thing.
No,
it's just
it's not.
our bodies are prone to it.
Yes, and
Right.
it can happen to men too.
She's like,
Okay. Can I go to you for the oral vaccine as well?
You can.
You can-
if you can.
Seriously,
yes,
men can
yes.
take that too.
you can't just take it for the sake of taking it, Glenn.
You can-
Can I
you can
try?
Prevention,
Can I
You
try?
have to no, you have to fit the criteria.
Yeah.
Yeah, because
He
it's
just wants to
under
try it out.
under monitoring by HSE. Yes.
I see. Okay.
yeah.
Well, thank you very much, Doctor, for
Thank
talking to
you.
us today and coming in.
Thank you.
Thank you.
Yes,
Thank you very
so
much.
nice.
Very informative. Thank you.
Hope you enjoyed yourself.
Thank you. Thank you.
All right, we've been speaking to Dr. Shirley Bang, urologist from Parkway East Hospital.
Thanks for prioritizing your family's health and tuning in to Good Morning Doctor. Brought to you by Parkway East Hospital. We go out of our way to make you feel at home.